In the last couple of hours, 3 measles cases have been confirmed in Canterbury. A teenager and a man and a woman in their 40s. They're from Christchurch and Rangiora. This comes only days after it was revealed an 18-year-old University of Otago student in Dunedin contracted the disease. The Canterbury DHB says none of the 3 people affected had up-to-date vaccinations for measles, and that ensuring MMR injections are up to date is the best protection against the disease, which can be life-threatening. Our South Island video journalist Logan Church spoke to the Canterbury Medical Officer of Health, Raymond Pink, at a Christchurch health centre a short time ago.
This office has been notified of 3 confirmed cases of measles. These cases include a teenage male and a female in their 40s from the Rangiora and Christchurch. And as far as we're aware, the cases were not fully immunised.
And when were these cases confirmed?
Our first case was confirmed on Friday of last week, and our last 2 cases were confirmed yesterday, the 25th of February.
And these 3 people, how are they now?
They're all recovering really well. 2 were admitted to hospital, but 1 wasn't, and there is 1 remaining, I understand, and continues to improve.
I suppose any confirmation of measles is obviously a worry to any DHB, especially only days ago down in Otago Way it was confirmed that a student down there had contracted measles. How worried is the CDHB now?
I think that the District Health Board is putting a lot of resource into identifying cases, chasing contacts, and ensuring that we can limit as much as possible any new cases in our community. And I think that emphasis reflects the concern and the importance that the DHB places on managing this illness. It's an illness which has complications. It's an illness that's potentially fatal. It's an illness that can be protected by immunisation, best protection.
And what sort of symptoms will someone have if they have measles?
You can have common cold symptoms, a runny nose, a cough, and a temperature associated with that. And this worsens to a point over 3 or 4 days where you develop a rash. And you can also have sticky eyes with that as well. And so over that 48-hour period where the rash appears, a person is really, really quite sick, and then they slowly recuperate after that. They are infectious from the time their symptoms begin until 5 days after the rash appears. I think we are continuing to follow up contacts. Obviously it's a highly infectious disease, and so those contacts, particularly who aren't immunised, are a concern, and so that process is happening. And I think at the moment there is 1 potential case that we won't know the results for until tomorrow, but at this stage it's only 3 confirmed cases.
How many suspected cases?
We have had close to, besides the 3 confirmed cases, we've had, I believe, 5 suspect cases who have all been cleared following testing that has been done.
How important is it to nip this in the bud now?
It's always important to make sure actually that we don't ever see measles, and we have the technology for that with our vaccination. And so if it does appear in our community, it's really vital that we limit its spread and put a lot of energy into that.
And that was Canterbury Medical Officer of Health Raymond Pink talking to Logan Church there.